trending today on Twitter, National Wine Day. It just doesn't get any better than that, and every wine lover will tell you about all the latest studies that prove there are health benefits, legit, that come along with drinking wine. Here to discuss these studies and other trending medical stories is plastic surgeon and my good friend, Dr. Erfani. Thank you so much for being with us today. Now, before we get to the wine drink, okay, never mind, let's just go straight there.
All right.
Here's one. I found this fascinating. A new study says that most women, if they had to choose, would prefer to have a better face, a more youthful looking face, than a more youthful looking body. 60% prefer face over body. This surprised me.
Well, what you have to look at, Dr. Gina, by the way, thank you for having me.
My pleasure.
My honor to be here. Is that last year there were about 16 million procedures done in the United States in the realm of cosmetic surgery or, cosmetic benefits, aesthetic procedures. Of those, greater than half of those are injectables or non-surgical procedures.
Right.
And the majority of those are done on the face. So obviously it makes sense. The face is where you primarily identify yourself and how you want to present yourself to the world around you. So, absolutely the face is the first place that's going to be basically exposed. And so it would make sense that that's where people are really focusing on trying to do their rejuvenation efforts and trying to better themselves. Of course, the body, as far as when it comes to surgery, the body is far and away much more common. Out of those 16 million procedures, 1.7 of them are surgical procedures, 1.7 million, I should say. And of those, the most popular procedure would be breast augmentation, liposuction. Traditionally, year after year, those are the most popular procedures. But greater than several millions procedures will be done on the face, injectables like Botox or Juvederm or things like that. Those
are repeat things that you have to do often.
Yes.
And so that makes perfect sense. And people ask me on Twitter, and you're on Twitter too, Dr._Erfani, just like it sounds. It's very phonetic. And I'm at Real Dr. Gina. And people ask me on Twitter, would I answer that question? Which would I prefer? Do I prefer to have a more youthful face or more youthful body? And I want to say warm heart, and I want to say body second because you think about health for body. I don't know if your face really affects your health as much as your body, so you'd think, well, okay, body. But then I really have to be honest and say probably it is face, because in my work, it's kind of important face thing, so maybe that would be my first concern. But anyway, but this is the thing. If there are people who, you mentioned some of the different procedures available, who maybe don't want knives anywhere near their body or their face, what are some of the more natural things that people can do today?
Well, the procedures that are available for people to make themselves natural, to me, everything's natural. Even surgery is natural. But the non-surgical options, such as the fillers, which are made from hyaluronic acid, which is a natural substance that occurs in any living organism, those are basically adding something that you already have in your body. Personally, in my practice, I try to advocate fat grafting, which is using some of the fat that's harvested, let's say, from liposuction.
So
and
your own natural
tissue.
Can't get much more natural than that.
Absolutely, absolutely. And this can be a source of great volume for the face, where you can provide that natural accentuation of your bone structure, which looks youthful. If you look at someone who's in their 20s or their 30s, you're going to see some nice areas of fullness on their face that provides a rejuvenated look, as opposed to, let's say, someone, if you go back to the 80s, harken back to the 80s, when the facelifts were done and they were extremely pulled, very unnatural looking. Someone would look very smooth or wouldn't have wrinkles on their face, but is that necessarily a youthful look? You can tell someone looks good, but they're not necessarily youthful for their age. So natural, there's all kinds of the filler substances, your own fat. Someday this is going to turn into stem cell therapies. Right now, that hasn't been really figured out quite yet, and that's under investigation.
Well, fingers crossed for that, then.
Oh, that's going to come.
Because any of those sorts of natural things that you can do with your own body, in a super 100% organic way, to me sound the safest rather than injecting chemicals.
Absolutely.
But it's up to each individual person. But here's a question for you. How young is too young? Because I've heard a lot of people. Now, I think it's different if it's a corrective surgery.
Right.
I confessed to you earlier, my dream was to be a plastic surgeon, and because I wanted to go to countries where babies were born with facial deformities and change their lives. I thought that would be the coolest thing in the world to do. Maybe you'll take me along someday. But how young is too young for what is really a cosmetic procedure? At least with your practice, what's your measure?
The way I look at it is that you want someone to be a responsible adult before they make a decision of that nature. So I personally, when someone's talking to me, let's say about doing work with their breasts or their body, unless their parents are bringing them in, and this is someone who has demonstrated responsibility in their own decision making and has the consent of their parents, I like to go for the age of 21 or 22 to give someone a chance to grow and make an educated decision about undergoing this process. Because, you know, there are certain things that, of course, you can always undo surgery and things like that, but it's probably better that you've made that decision under your own, you know, through your own experiences and understand the gravity of that decision, whether you might regret it later on. Now, very frequently you won't, but there are certain situations where people might regret that they might have done something when they were too young or too early. I know that there was a particular article we were discussing which had to do with Botox, and that being done under the age of 21. That's something that I personally wouldn't offer. I'd really like someone to have a great understanding, because in the end, this is about a personal decision. There's a personal decision to make yourself feel better, look better, and you should be the one who's advocating that after having a sufficient experience and understanding of how to make a decision of that magnitude. So.
Right. And you know, I will tell you that when girls get together, we do talk about shoes and handbags, but we talk a lot about, like, what's your favorite beauty product? That's one of my favorite questions. In fact, I don't sit down at a makeup counter before I go on a television appearance that I don't ask that makeup artist, what's your favorite product?
Right.
But an article I read today said that we can actually become immune to beauty products, and including some of the injectables that you were talking about.
Well, absolutely. So, you know, talking about the injectables first, let's say with Botox or with one of the other neuromodulator products, the products that actually help to reduce the muscle movement in the face, you know, there has been described, and it hasn't really been studied very deeply, so I want people to take this with a grain of salt, but there has been described a situation where people, generally we tell people when they've had the Botox treatment, if they're repeating the treatment, they should see longer lasting results, because essentially they're reducing the activity in the muscles in their face.
Right.
And so as time wears on, those muscles begin to atrophy and actually diminish their activity. So, but what also could happen in a very rare percentage of the population is that people start to find that the product isn't lasting as long. And it's been thought that it might be actually a reaction from within your own body that starts to reject the product.
Like almost an immunoreaction.
Like an immune reaction.
It's an invader, makes sense.
So it's pretty rare, but there are products that are, you know, you might want to try a different product, you know, instead of the one that you've been traditionally using, to see if that picks it up. Xeomin, which we like to use, actually lacks some of the proteins.
And it's like an equivalent for Botox. And so there are equivalents that are coming out. Of course, you know, they're making money with all of this, so they're going to come out with new products. And so there's promise in that.
Correct.
All right.
And as far as, let's say, your makeup items or your products that you use at home, there's expirations on those. Sometimes there's active ingredients.
So pay attention to those expirations on the side of it. You're the best. Thank you so much for being with us.
It was my pleasure.
I wanted to get to like 20 other things. We need to have you back.
My pleasure.
Thanks for being with us.
Thank you so much.
That's Dr. Erfani. Find him online at spiritliftplasticsurgery.com. Stay where you are. More in a moment.